Hi, welcome. Good afternoon, everybody. Thank you very much for coming to this exciting first event for Leeds. My name's Phil Wood. I'm Medical Director for Strategy and Planning in Leeds Teaching Hospitals, and it's my pleasure to introduce the first session of this, what I think will be a really great afternoon. So what we had wanted to do with this event was to ask the voice of you, the students, to come and tell us what you thought the future was going to be like for you and what you wanted that future to look like. And we want to give you the opportunity to talk to system leaders, to national leaders, to people involved in the university, in the health system, in the care system, in education, to give you the opportunity to describe to them what you think that kind of landscape needs to look like. And there are some real challenges that we face with the future workforce in terms of what that workforce is going to need to deliver for our citizens. So this is the first, we hope, of a number of these kind of events, starting with our future medical workforce, but rolling that out to our other health professions. So this has been put together by the Health Academy in Leeds. That's a unique partnership between health, education, between all the key partners in the city in terms of trying to shape a single ambition for the city, a single workforce for the city, and bringing together the opportunities around resource learning and career development for that whole workforce. So they've been the driving force behind this. I want to mention Ross Gillespie and James Nicholson, who Ross is here somewhere. Thank you, Ross, for really helping to shape this event. And I know the two of them have had a chance to talk to student colleagues about what that should look like. So this has been a real kind of co-produced event between the two sides. So what we're going to do, we've got a first session where we're going to hear from three key leaders in their areas, and I'll introduce them one by one in a moment. Then we've got kind of some feedback from a video. So the Academy's asked a number of you who may be here today, I don't know, I've not seen the video yet, to give us your kind of videoed view. I'm told it's a kind of warts and all video, which sounds great, because I think it's important for us leaders in the system to hear what you actually think, as opposed to what we think you think, or even worse, what we think you think. And after that, we're going to have some breakout sessions, which are in the room opposite. And I'll again talk those through, but you've got numbers on your badges, which will explain which tables you go to. I'll describe that a bit later. And what we really want to get out of today is to capture what it is you think that future is going to look like, because we've got to take that back into all of our organisations. The future is going to be different for you than it has been for everybody who has worked through the system so far. We know what the challenges are, but it's about how we respond to those challenges. So we're going to be using a hashtag on Twitter. There's a Twitter feed out in the atrium, so please use that. So we're now going to have three relatively short presentations. The first is from Professor Trudie Roberts, who's a Professor of Medical Education here at the University of Leeds. Trudie graduated in Manchester, and from 2000 has been the Professor of Medical Education here, was awarded a National Teaching Fellowship in 2006, and for a relatively short period in the delightful Beckett Wing building, which I'm sure many of you have experienced. Trudie and I used to do some clinics together. She served on the GMC Council and the Royal College of Physicians of London, and was previously a censor for RCP in London. She's currently president of the Association of Medical Education in Europe and is an education board member for the Royal College of Physicians and Surgeons in Glasgow. So thank you, Trudie.
Well, thanks very much, Phil. And it's a great pleasure to be here and to share some ideas with you about what the future might look like. So I thought about the title we're producing, 21st Century Healthcare Professionals. Now, whether you knew it or not, we are living through a revolution. And I, at my age, always wanted to live through a revolution. I was the one with the Che Guevara poster in my student flat, of course. And throughout history, we've had industrial revolutions. So we had steam in the 1700s, electricity in the 1800s, computing in the 1990s, and now internet and intelligence. So it's actually being part of our everyday lives. It's not something which is unusual. And this is really important because it's going to change everything that we do. And what it will mean is that there is hyperconnectivity. So every part of our life will be connected. And for those of you who's got one of these things, and I guess I should be asking who's not got one of these things, you think it's a smartphone, don't you? You think it's smart. Well, it's not that smart. This is the smartphone of the future, which will do everything to look after you, in actual fact. And this picture, I'm grateful to Eric Topol, who actually was in charge and led the Topol Review. Now, the Topol Review, which was commissioned by the previous Secretary of State, Jeremy Hunt, and was supported by Health Education England, was a really important review because not only did it look at how the health service would change with technology, but most importantly, it looked at how we were going to prepare the workforce to deliver that change, because mostly people come along with shiny new things and don't think how the workforce is going to be supported to deliver this sort of thing. So within this review, these were the top technologies that people thought were going to come on stream over the next decades. And this is a heat map which shows you the number of technologies, so there are 10 down there, and the percentage of how it will affect the workforce is on the other axis. So this is really important. This is what we're taking as potential for the future. Now, meeting the needs of the current workforce, for all of you who go to mandatory training, and you know how important that is, I'm hoping that that will be a thing of the past, where people just sit there taking screenshots of those fire extinguishers so they can answer the quiz at the end. And I know who you are. But it's about actually having time to do CPD, and for that CPD to be relevant to what your role is, to what you're doing. So each person needs a comprehensive learner profile and to be given the opportunity to learn those skills they're going to need at that point in time. For the undergraduates, and for those of us teaching the pipeline, the people who are going to come out and deliver tomorrow's education, this is the issue that we're dealing with. And I couldn't put it better than Andreas has put it. So today we're preparing for students for jobs that have not yet been created, to use technologies that have not yet been invented to solve problems we don't know will yet arise. And that's the excitement. That's what gets one out of bed in the morning. And it's really, really important. So let's think about the education and training needs for the future workforce. So we need to articulate what are the knowledge and skills and behaviours that are going to be required for the future. There's going to be a need for new professional groups in the future: engineers, computer scientists, data scientists. These are going to be new groups which need to come into the health service and have a career pathway. And then we can then reconceptualize into professional learning. So let's look at what knowledge will be required in the future. When you think about the exponential rate of increase in knowledge, what is it that people are going to need to cram into their heads? So where should that knowledge reside? Should it be between skull and skin, or should it actually be within your phone? When you've got one of these, you've got all the knowledge in your hand since civilization began. So what should we be asking people to commit to memory? So things like if Phil collapsed here now and I took my phone out to look what to do, people perhaps wouldn't be so impressed, particularly if it was anaphylaxis. So certain things you need to keep in your head, but other things might be the current guidelines for asthma. You're actually not going to need to keep in your head. You need to know that they're there, but you need to be looking up the latest guidelines. So this then is the concept of the extended mind. The mind is not just what's in your head, not that it's that grey piece of matter that's in there, but actually it's you and your device and the internet and wherever the cloud, wherever knowledge resides. And this brings the machine as part of the team. So how do we teach that for the future? How do I go back and teach that to my medical students so that they're well equipped for the future? What skills will be required? Well, I don't know where the dean is. Oh, he's over here. So the dean's very keen on his stethoscope. So here is a stethoscope. Linect, 2016, 200 years since it was invented. The dean's holding on to his, but in fact, he wants to throw it away and to have a handheld ultrasound machine. So what I'm saying to you is, if you've got shares in Littman, sell them now, because it's going nowhere, I can tell you. What about taking an ECG? You can take an ECG on your phone. This is my ECG before I gave a talk, an international talk, and you can see how anxious I was at that point. And now, of course, I can do it on my phone. This changes everything that we teach. What new skills are going to be required? Well, genomics, information technology, big data. These are going to be new skills that we need to equip our graduates with. And things like programming. Now, I find that quite contentious because, of course, if we teach programming now, we'll be teaching Python. If we're teaching programming in 5 years' time, it might be white tarantula. I don't know what it will be in the future. So we've got to decide what we teach people now and what we leave till later. So, is this the future of medicine in the next 10 years? Well, it can't be, can it? Because this robot isn't bare below the elbow. So that's the reason that this picture is not true. And actually, it's not going to be that, is it? Because the skills that need to be retained are those skills of empathy, of compassion, of actual human touch, of negotiation, of behavioural psychology. So within all this technology, what we mustn't forget are the things that healthcare professionals do and do really, really well, which is patient contact and patient care. So what skills need to be enhanced? In fact, so we've gone through what skills people need, what things we might be able to get rid of, what need to be enhanced. I would say it's things like problem solving, innovation, enterprise and critical thinking. These are going to be the skills, the key skills for tomorrow. Dealing with uncertainty, because that's going to be the future, and actually embracing change and leading that change. And interprofessional team working. But what is this going to look like now? So maybe if you're a rehabilitation physician, you're working with an engineer who's working on prosthetics, who's working with a computer scientist, who's working with a sculptor, if you're actually making prosthetic limbs. So things are going to change a great deal. So interprofessional working for me is no longer just going to think of in terms of doctors and nurses, nurses and pharmacists. It's going to be far, far broader. So what are these new professional groups? Well, within the Topol review, these are the things that we came up with that were missing. And I think the thing I want to emphasize here, besides the technological things, are things like ethics and data privacy. This is going to be really, really important. And in some respects, the technology is running away with us, and we're not actually looking at governance, security, ethics, and data, and whose data is it, and involving patients and their carers, of course. So, the past we'll need to learn from. The future we don't know, but it's exciting. And what we need to be discussing today is what are we going to do now to ensure that our future is successful, but not forgetting to have learned from the past. Thank you very much.